What's up, people? It's Dr. YouTube. Today's talk will be all about complications of fracture. Let's first look at what actually happens after a fracture. How can the bone get displaced? Well, it can be angulated. You've got varus and valgus deformities. Valgus is, for example, if you imagine this is the knee looking from behind. You've got you see the knee joints are close together, so that's like a valgus deformity. Okay, you've got varus, which is the opposite, so the knees are spaced apart. So that can sometimes happen after fracture, for example. You can have displacement. For example, this is your proximal bone, that's your distal bone. It can be displaced. So you've got either medial or lateral displacement. This all depends on the how it is in relation to the proximal bone. So that's because this is the medial side to the proximal. So we've got lateral displacement. Yeah. If this was here, then this would be medial displacement. You can have shortening. So you see the bone was originally meant to be here. It's gone up. So that's shortening. You can have rotation. Okay. So that's like a 360 degrees or however you want to call it. You've also got impaction or distraction. Impaction is together. Distraction is apart. So you've got a few different modalities just after a fracture. Now, what can happen after fracture? Well, you can damage nerves, so you can have a lot of pain, nerve pain, okay, pins and needles. You can a blood vessel may burst. You may develop shock. There may be damage to surrounding organs, such as the lungs, and because bone contains a lot of fat, sometimes fat can go up, and you can get a fat embolus. You may feel short of breath, for example. Okay, so that is the immediate complications. So with from minutes to hours, what happens from days, within days period of time? You can have infection, especially with open fractures. So remember, open fracture is open communication between the skin and the bone. So there's immediate need to clean the area, give IV antibiotics, and give tetanus prophylaxis. Never forget your tetanus prophylaxis. Also, you can have, because you'll be in a lot of pain, you won't be mobilizing, you're at risk of clots. It's important that you start them off on a low molecular weight heparin prophylaxis or whatever hospital policy you have to prevent clot from forming. You can also have blood accumulating in a closed space. So, for example, in the tibia or the forearm. And as blood builds up in a closed space, right, you can have ischemia of the muscles. And that may present as pain. Remember the P's. So pain, out of proportion, pallor, looking very pale, pulseless, paresthesia, perishingly cold, and paralysis. So these are important markers of compartment syndrome. And if that does happen, you have to involve an orthopedic surgeon immediately, or do it yourself under supervision to open the fascia, perform emergency fasciotomy. What happens here is they basically cut the medial and lateral aspect to release all the pressure and the clot to reduce ischemia. Right? You can have a vascular necrosis, and that commonly happens in the femoral neck, or in the scaphoid bone because of the relatively poor blood supply. On an x-ray, how would it look? Well, Acutely, it can look normal, but over time, you can develop uh, osteopenia and osteoarthritis. So now, over weeks to months, what can happen is the bones don't heal up, especially if it's poorly positioned. You can have malunion, in other words. You can have, so malunion is where it joins unsatisfactorily. Non-union is where it doesn't heal at all. So malunion or non-union. You can have also Sudeck atrophy or complex regional pain syndrome, where you've got an excess of sympathetic response, and what you get is a lot of swelling, pain, and redness. Okay, one would need to rule out other causes, which may present with a swollen limb, like a DVT, for example. So those are the late complications. So let's recap once again. What can happen after a fracture? Well, it depends on how it gets displaced. The joints can have a varus or valgus deformities. So this valgus may be displaced medially or laterally, may be rotated or disimpacted. You've got, always remember complications, think immediate, early, or delayed. So immediate, damaged nerves, damaged blood vessel, damaged lungs or organs. Early complications include infection. You want to reduce that with giving early antibiotics, giving a good clean out, giving prophylaxis for tetanus. You want to reduce risk of clots forming, give them prophylaxis, observe for compartment syndrome, especially in the tibia, and making sure fractures are managed promptly to avoid avascular necrosis, where the bone just dies away. Immediately, the x-rays may look normal with avascular necrosis, but over time you can have osteopenia and osteoarthritis. From weeks to months, you want to avoid these complications by making sure that the bones are properly properly and proximally relocated to avoid malunion, where it doesn't quite join satisfactorily, or non-union, where it doesn't join at all. One thing to observe is to avoid Sudeck atrophy, where it can present with a unilateral, hot, swollen limb. And there you go, guys. I hope you've enjoyed the video. Give it a thumbs up, don't break any bones, and have a great day. Take care.